Just a quick reminder before we start to silence your cell phones, please. And good afternoon. We'll call this Bridging the Gap subcommittee meeting to order. First order of business is the approval of minutes. You've had a chance to read the minutes. I'd entertain a motion to approve them.
Second.
Moved and seconded. Any discussion, corrections, comments? All in favor signify by saying aye.
Aye.
All opposed, same sign. Anybody have any old business? I don't think we do. Well, we won't waste any time. New business. I'd like to welcome Sean and Kristen to come and have a chat with us about their proposal. Welcome.
Hello, hello. Hey
Perfect.
guys. We ate at Chomp this afternoon for lunch. It was phenomenal. If y'all have never been, please go. I'm sure you have. I think we saw you in there. Thank y'all again for having us. As Kevin said, my name's Sean Canterbury. I'm the director of our business development for Inmar, as well as Kristen Kapakava. She is our manager of our government solutions. So we're very pleased to be here with you guys today. So with that being said, in 2023, 79,000 people died from opioid deaths across the United States. Something you guys are very familiar with. That's basically 215 people per day, which means a Boeing 737 going down every single day. If that were to happen, then we would have grounded every single plane across the United States. We're here today to talk about our solutions, all of it focused on prevention, because we believe that it's more important to stop it before it starts. And we already have some good members in the community that are participating with us. We'll talk a little about those as we go through the presentation. So to the next slide, please. Thank you. Let me put on my glasses so I can also look at my note. So really the stat here that hit me was the last stat, which is 60% of the county residents, or pardon me, the county teachers and counselors report student substance abuse starts in grades 6 to 8. The reason that's important to me is because my wife is a guidance counselor. Matter of fact, she was a guidance counselor at our home state of Tennessee in middle school, where there was multiple occasions where we were affected by that way, and I'm sure all of you have been affected in one way or another by this as well. And really the question that I have for everyone is, when we look at that, how are those children getting medications? How are they starting? Well, really it starts in our own homes. I can say that it did for us. We had unlocked cabinet, and it allowed our children to gain access to our medications. And so that's why we believe at Inmar that prevention really is the key for everything. A 2023 cohort study of 1.69 million adults in Oregon found that in households where another person had filled an opioid prescription in the prior 6 months, the individual's odds of an opioid-related overdose, fatal or non-fatal, were almost 2 times higher compared to households with no opioids filled. If you go to the next slide, please. Thank you. So you can see that green receptacle there. That may be familiar to you if you've ever been to the Meyer location, because they have a green receptacle in their pharmacy. That's ours, and we work directly with them to help with community disposal. So who is Inmar? We're the critical operational component. We work with health systems and independent retailers across the United States. We work with ProMedica, Mike Pharmacy, Village Pharmacy, and Meyer in some capacities. Primarily, we work with them on what we call our RX returns business, meaning we take care of their expired medications that are within their pharmacies. We handle those. We handle their recalls. We handle their waste components of those. And then the reason is, why are we in consumer drug take back, which is what we're presenting today? Well, in 2010, the DEA allowed for law enforcement agencies to be able to house kiosks for the community to deposit their unused, unwanted medications. In 2014, the DEA amended that to allow for pharmacies to begin to house kiosks so that they could help the community to dispose of their own medications. We, as a reverse distributor, are licensed to be able to handle the final disposition of those liners. So that's the main reason we got into that program. But what we found was that while the larger cities had pharmacies, they had local law enforcement, law enforcement, places where you could actually put those kiosks, there was many underserved communities that didn't have access, didn't have very, very convenient access to those. So we started up a mail-back program. The mail-back program are envelopes that can be placed in any community-facing business so that citizens could come in, grab an envelope, take it home with them, drop their medications into it, put it in the mail, send it to us, and we end up disposing of it. It's all done anonymously, just like the consumer drug take-back kiosk that you're looking at there. What we also found was that there was also a need for sharps disposal. And so we then began offering up what are quart-sized containers to dispensers of sharps, so that as they were dispensing sharps, they could actually dispense a way to dispose of those sharps once they were used. So I'll bring on Kristen to talk a little bit more about our different solutions.
Yeah, thank you. So as Sean so beautifully described, we have 3 different methods of disposal that we're proposing to you. And the goal with proposing all of these is really just to create convenient and equitable access across the county for all residents. And these solutions work together to provide that. The first of which is what we refer to as our kiosk. It's an 18-gallon cardboard box with inner liner. It has a drop-down box. Again, you're probably familiar with seeing it at Meyer. You can't get into it through the drop door. It has locks. It's very, very secure. It complies with all state and federal regulations. However, it has limitations in the fact that it can only be installed at DEA registered locations. So thinking hospitals, pharmacies, law enforcement agencies. And that is why we also like to provide our mail-back envelopes. These can be distributed widely across the community in any place from a church to a post office, a library, basically anyone willing to put the tabletop display out on their counter can provide this solution. We send the envelopes in packs of 50. They come with a card inside the envelope, which tells the resident how to dispose of their medications, what can and can't go in the envelope, and how to send it back. It's pre-addressed, prepaid, nondescript, has an absorbent pad inside. And when the stock gets low, there's a visual reorder trigger for the location, whoever's managing that site, to be able to order more envelopes from us. And then we also have our sharps containers, because as you probably know, GLP-1s and injectables are becoming very accessible. They're being shipped directly from compounding pharmacies and manufacturers to the home. So we found that this is an increased need in the community to be able to provide a safe way to dispose of these sharps containers. So we can also provide these in bulk. They can be given out at virtually any location, just like mail-back envelopes. It's a 1-quart container, which can hold about 70 to 100 needles. And it has a flip lid with a pedal insert, so you can't go back in and grab anything out of it. And then it comes with a pre-addressed prepaid box. So it just goes into the box and gets shipped back to Inmar for disposal. So, let's see, you can go to the next slide. So what we wanted to show you here is that we, in our own research, came up with at least 150 locations across the county that could be either a kiosk drop-off site or a mail-back distribution site. We just wanted to show you the geographic spread of what that could look like and to report on our current kiosk at Meyer that has collected 2,600 pounds of drugs since 2019. So it's obviously being used. It's a successful program, but we want to increase the access to everybody. And then I wanted to talk a little bit about, you can go to the next slide, implementation and what that looks like. So from our experience, we typically see the first 90 days is all about enrollment. So we're contacting the sites, we're verifying their eligibility to participate, establishing agreements, all of that type of thing. And then the next 90 days after that is fulfillment and distribution of the material. So it's either Inmar installing the kiosk or us direct shipping the kiosk to the pharmacy or hospital for installation, or sending out the mail-back starter kits to the pharmacies or to the locations and rolling into full operation of the program, including training. We also provide a starter kit to the location, which includes some resources and social media templates, things for them to be able to promote that their location provides this service. And that's something that we can also provide to the county to use in whichever way that they would like to provide that to establish some outreach and promotion around the program. And then from month 6 and ongoing, we provide monitoring and general maintenance of the kiosks. We do a auto replenishment of kiosk supplies every 3 liners. So once we receive the second liner back from the kiosk, we automatically send 3 more liners, and that can be scaled up and down depending on the volume. If one location seems to be returning more frequently, we can increase that. And then lastly, we can provide reporting. Every mailer, sharps container, and kiosk liner is serialized, so we can provide you with data on how many liners we're receiving, what the weight is. We can't open or anything about like what's inside, but we can provide you at least with the utilization and the weight. And that reporting can be done either quarterly, annually, or at your preference. So with that, I think we can, yeah.
So one other thing we wanted to mention is we didn't just come down to eat lunch at Chomp. We also stopped by several locations on the way in, just to kind of get an idea of what the appetite would be from the community perspective. We stopped by a few pharmacies, stopped by the local hospital to kind of make check on the box, see what it was doing. They said they just had a successful take back day not very long ago, that they continue to see that medications are coming into the box they currently have. As we talked to other local businesses, there was a need and people that are wanting to participate in this as well, if we're so lucky to be approved. So with that, we'll open it up to questions.
Any questions? Sheriff?
There we go. You just mentioned that ProMedica had a successful take back day. I know we've been partnering with them there for a long time. When they take the drugs back there, are they going to you? Because I seem to remember my captain taking them to DEA in Detroit to be disposed of. So that you don't dispose of those?
Well, we would be a replacement for that. Is what we would be. Currently, the DEA operates 2 take-back days a year. That was the most recent one that they had. They also hold another one in May, I think it is, April, May, something like that. But that's done directly in partnership with the DEA. We would be we try to make it where, hey, it's take-back day every day. That's why we're trying to make convenient access.
One thought.
Sure.
Are you for-profit, not-for-profit?
See, we are for profit.
For profit, okay.
Judge Morgan?
On your materials, it said at retailers, and then you mentioned like at Walmart. Can you place them in any retailer, or do they have to have a pharmacy within that retailer to place it?
Yeah. For the kiosk, it must be placed near the pharmacy.
Okay, so the local stores like Bush's and Tecumseh, or that would not be eligible because they don't have
For the
a.
kiosk,
No,
they could
They
host
could,
the mailbox.
that's correct.
we could host the mail packet.
That's good.
And then you had the Sharps container. Now, obviously, if you fill up a Sharps container, then what do you do with that? Is it,
It's prepaid as well, so it would be sent to us for final disposition.
Sarah?
Thank you. So I guess mine is also about the Sharps container. My mom was a True City user, so I always had all these auto inject pens that I'm like, you have to store them until the take back day. So how do people get that container? So somebody has to hold all those containers in order to receive them, and how do the people find out that there's a Sharps container that they can come and get?
Yeah, so part of our discussions today, as we walked into, I think it was Adrian Medical Pharmacy, I think is what it was. The gentleman that we talked to there, he would actually house those, the quart containers in his pharmacy. And then as he dispensed those, Sharps, he would actually hand out a container, to his patient, if you will. Or if the patient requested one, he could provide it there.
Okay,
Again, we're not limited, the Sharps containers aren't limited to whom can actually hand those out. They're very similar to the mail back envelopes. We could dispense those.
okay, okay, and that's correct that the kiosk is for pills only?
Yes, ma'am.
Correct.
Yes, ma'am.
Okay.
I just wanted to add too that if we're approved, you would be assigned a designated representative from Inmar to manage your program. So that person would be identifying the location, doing the outreach, calling to find out, are they willing to distribute the Sharps containers, arranging for the shipment of those Sharps containers to the pharmacy. So all of that work comes back on Inmar. But you're involved in every step of the process. If you have suggestions about where you want things to go, or, whatever level of involvement you want to have in that.
May I ask one more?
Sure.
Who empties the kiosk?
The pharmacy,
The pharmacy does?
yes.
Okay,
Self-service returns, they're trained on how to do that.
got it. Thank you.
Yes, ma'am.
Brana, then Tim?
Yeah, thanks. I had a question about the sustainability part of your proposal. And clearly, you're looking at the 14+ year period of the settlement funding to carry this forward for quite a while, should that be awarded. In other parts of the nation, because you're in 49 states, I noticed, what's the typical funding source for these kiosks?
Really, it depends. So a lot of them are grant funded. Some of them are retail funded. Some are actually manufacturer funded. So it really depends on, it can really be funded a bunch of different ways, but primarily those are the three main ones that we see.
Okay. I see. And then the other question, if I may, Mr. Chair, is related to the evidenced in their proposal and in all the proposals. If it is new, quote, new, this is new, it would be new in terms of this area, but not new in terms of what your
Right.
service is.
Correct. Yeah.
And so is it based on evidence-based practice? And I'm going to admit that I did not click the links to read these studies, and perhaps the answer to my question is contained in these links. But is there evidence, since this has been out for a while, in a reduction in the ability to, how are you measuring prevention outcomes? That's really my question.
Sure. Our measurement of success really comes from how much we're receiving back. And to date, we've received 4 million
4 million.
pounds in medications back. This is a DEA approved and recommended solution for the return of expired and unwanted medication. So we believe the evidence is in that alone, but we can say that with 4 million less drugs in the household, we feel like we are providing a good prevention method.
Do you have a breakdown on what percentage of those are actually, substances that are typically misused?
Unfortunately, we're not allowed because of regulations to open liners or mailers or anything like that, so we can't say what's inside, only go by weight.
Okay, Tim?
Pretty simply, what can be put in the kiosk? What can you drop in there? Because I know it used to be like syrups and things like that. Can that be disposed of? in there?
Correct. It's pills.
Only
But
pill-
again, we can't open the liner.
You can put everything in there, the regs say no hazardous waste. The regs also say no sharps. You know, those are pretty much the two that are exempt from being able to put it in there. Pretty much anything else though goes in there.
And can you touch on, explain a little bit more about the representative that would be working with people? Because we know that we have this at Meyer and we don't have it at Walmart. We don't have it at other places. How does that process go by which someone's going to be working with those entities?
So there's a couple of, the good thing is we have on-site presence here. So Julia Jordan, is our local CDR, client development representative. She's the one who services the ProMedica, facility. So she would be your on-site representative. And then on top of that, we have specific, account representatives, that work directly with Walmart corporate, Walgreens, CVS. They're all three clients of ours, in other capacities. So they would work directly with those sites as well to help them.
Other questions? Terry?
Few, if I could.
Sure.
Are you familiar with the Big Red Barrel program?
Daryl program? No, sir. Sorry.
Several years back, a gentleman out of Brighton, Michigan, I believe, had a son that died of an overdose. He began a campaign basically through law enforcement. And as far as I know, at least in Lenawee, virtually every police department in Lenawee County has a kiosk. They're not all red anymore, but they're all referred to as the Big Red Barrel. And it's for exactly this purpose. Been advertised a bunch, and is doing quite well, I think. So my questions I have are a couple. You showed this illustration about the different places in Lenawee County where it could happen. These are not all kiosks.
Not all kiosks, no.
That's correct. It'd be a combination of both kiosk, potential kiosk location,
So
as well as potential mail back.
the kiosk could be in pharmacies.
Correct.
Sure.
Yeah, but our hope would be that because someone's closer to their church or their doctor's office, or because they're already going somewhere where that has an envelope, they would be more willing to take that and use that versus someone who may not be comfortable going to a law enforcement agency or doesn't use a local pharmacy or whatever the case may be.
In the grant, if you listed in your application that you showed the municipalities that there's, you chose 5. Is there a reason, do the other municipalities not have pharmacies within the village?
So
or
I
city?
did an updated list. It has like, I can provide this to you. I can also email it to, but there's 150 locations. Not all of them are kiosks. There's probably about 30 kiosk locations, but it crosses over, I think there was 4 or 5 cities plus all the towns and villages. So I checked all of them to see what kind of locations. They don't all have kiosk locations, but they all have virtually some sort of option for mail back envelope location.
Okay, and I guess one more if I could, Mr. Chair. And maybe I heard it wrong, but when someone takes one of these envelopes, puts their drugs or whatever in, seals them, is this mailed through the postal system?
Yes, sir.
Do you not have a concern about most of the employees realizing that, hey,
We had the DEA has approved, that as the proper means by which to send those. It's an opaque, and I wish I had one I could show it to you. It's an opaque envelope. There's nothing special written on it whatsoever. And then of course they're all serialized as well. So we can track those, through the mail as well.
okay, but much as a sheriff, my background's law enforcement, and it just seems to me that's an invitation for post employees of a certain ilk to say, well, here's a ready source.
Yeah.
Just start swiping these envelopes as they come in.
Yeah, I get that. Like I said, the only thing I can say is that the DEA is the one that told us that's the correct method to go.
To my knowledge, I'm not on the operations team specifically, but we have not had an issue with that, to my knowledge. We do have a team that specializes in any kind of diversion incidences or anything like that, which we would have immediate action on that. Anything like that were to happen with a kiosk or mail back, but to my knowledge, we have not had that experience.
Or if they're serialized, you see the envelopes are serialized. Is there a process, say Myers has containers 1 through 50
Mhm.
serialized.
Yep.
Is there a system by which you verify that the 20 that were taken from Myers, those 20 have been returned?
Well, we wouldn't, so we know what's been distributed out to the facility. So we can say numbers 1 through 50 were distributed to Meyer in this particular instance. What we don't know, because again, that's going home to the patient, we don't know when they're actually sending it back.
But do you know 1 through 50 have been returned, or mailed?
When we,
Yes, when we receive them.
yeah, when we receive them, yes.
Yeah, we just don't know how many are out in the community unused.
That's correct.
Any other questions? Yeah, I didn't realize the drug issue until my own family members, of course, that aged and then passed away, and left with these mountains of medication. If they were a cancer patient like my mother, hospice takes a number of the things away, but doesn't go through every drawer. And I said to my wife, well, we'll throw it in the dumpster. Well, she's a nurse. And she said, no, you're not going to do that.
Well,
So-
I think mail back is a really great solution, for example, at funeral homes, assistant living facilities. I mean, it opens up a lot of opportunity to get to those places where people are.
And we also found out what kind of drugs my grandmother was taking in 1961, so. Well, thank you for your time.
Thank you.
Thank you all very
Appreciate it.
much for
You
having us.
bet. Any discussion amongst us? I want you to know that I've been talking with Francine about putting together some kind of graphic interface for our meetings after the first of the year, to start and categorize these so that we can interact with this stuff here as a group and talk about how we're going to sort this stuff out. You realize that the numbers seem big, and then you looked at it, first round is $500,000 a year. It doesn't take more than a couple of these proposals to burn up a lot of that pretty quickly. So those are all the varying levels of discussion that we're going to have. But we're going to try and do the best we can to make that a simple process. So any questions, any other discussion at all? Me, I don't,
I think it's a good idea that we determine what types of programs we want to fund. And then from those types, those applicants.
and there are a number of them that I think, of course, we haven't polled everybody, but there are a number of the proposals that I think I'm willing to guess 70 to 80% of us have already ruled out in our minds. And so we will probably take a stab at those and based on the scoring and other criteria and keep you guys, because we don't need to move 25 dots around on some chart somewhere when we know a number of them are not going to make it to the final cut. But one like this, I mean, we all have time to think about it, but my read is it's very low cost compared to many of the other options and doesn't compete with any other proposals, and probably something that might get a different level of consideration than some of the other ideas. And so, and this was an area I hadn't thought of until I heard this proposal. So it's new to me, Terry.
But it would also relay to, for that matter, all the applicants, a couple of things. One, they might want to take a look at partnering with another entity so that they can better serve. Two, this is only the first round. If we may eliminate a program that may be worthwhile, but it's just isn't at the level and at a later application date, especially if they've collaborated with some other agencies.
And hopefully over the next few years, we get a sharper focus on what we think is effective. And was having a discussion with Francine, and we had a short discussion after accounts payable on this. What is our population really? I mean, we see numbers of 2,000 people out of 100,000 that maybe have this issue. What percentage of them are reachable? Is it 20? Is it 50 people? Is it 200 people? Is the 2,000 too optimistic? Is it actually 4,000? I mean, those are the things that are very hard to know, but sadly, we know that we will not end this. But can we move the curve in a meaningful way with the resources we have? We have enough money to accomplish some really good things if we're clever. But we all wish this gentleman made a great illustration, right? If one 737 was dropping out of the sky every day, there would already be substantial changes. But this, because it involves human volition and all manner of things, it's just much harder to deal with. Well, I don't need to belabor this. Anything else before I call for public comment, which looks like it's not going to take very long, seeing nothing else, I'd entertain a motion to adjourn.
So moved.
Moved and supported. All in favor signify by saying aye.
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 Opposed, same sign. Meeting adjourned.